Tam ekran yapalım. Şu. Tamam.
Ladies and gentlemen, we back to your live screen again with Prof.Dr. Birol Vural from KOLAN Hospital Groups. Shortly, he will gonna share his topics and presentation with us. Professor Birol, the floor is yours. Please go ahead with your presentation.
Okay, hello to everyone. Congratulations to organizing committee for this beautiful congress. My name is Birol Vural. I am professor of OB/GYN and I am responsible of Istanbul Şişli KOLAN Hospital IVF unit. My subject for this congress is IVF and endoscopic surgery. Who am I? I graduated from Ankara Hacettepe Medical Faculty. I am a reproductive endocrinology and IVF specialist and endoscopic surgeon. I am founding faculty member of Kocaeli University Gynecology Clinic and IVF unit. In my 35 years of professional life, I have trained many medical students and obstetricians. I attended infertility and...
Professor Birol, you need to change your screen as well in our main screen, please. Don't forget that.
Okay.
Yeah.
Who am I? I graduated from Ankara Hacettepe Medical Faculty. I am a reproductive endocrinology and IVF specialist and endoscopic surgeon. I am a founding faculty member of Kocaeli University Gynecology Clinic and IVF unit. In my 35 years of professional life, I have trained many medical students and obstetricians. I attended infertility and IVF courses at the Free University of Belgium, Istanbul University Faculty of Medicine, Zeynep Kamil Medical Maternity Hospital, and American Share Institute. I have over 200 scientific publications. I have more than 60 scientific articles, most of which are in the Science Citation Index. There are over 900 citations to my scientific articles. I have been deemed 40 of 6 scientific awards in my field. I have had thousands of couples to have their children with IVF treatment and endoscopic surgery. Firstly, I will talk about our IVF clinic's works. VM consensus report at the meeting of the ESHRE special interest group in 2017 is the most preferred international performance indicators that should be used in evaluating the success of IVF centers. We evaluate the success of KOLAN IVF unit according to these criteria. This table explains our success according to VN consensus performance criteria. We can proudly say that the results of our center are above the benchmark values. ICSI fertilization rate in our clinic 83%, blastocyst growth rate 65%, successful embryo biopsy rate 99%, blastocyst toe viability rate of 99.8%, blastocyst implantation rate 64.8%. Our pregnancy rates by age under 30 years old, 18.8% pregnancy rate. Between the ages of 31 and 35, 72.2%. Between the ages of 36 and 40 years, 63.5%. Between the ages of 31 and 43, 45.7% pregnancy rate. Over 43 years old, pregnancy rate 18.2%. Şişli KOLAN IVF pregnancy rates on the 5th day transfer according to number of embryos transferred When one embryo transfer on the 5th day is done, pregnancy rate is 72.6. When 2 embryo transfer on the 5th day was done, pregnancy rate is 78.2%. This is important. On the 5th day, even with a single embryo transfer, we can get results very close to 2 embryo transfer. This table explains the pregnancy rate of pre-implantation genetic diagnosis. We achieve over 99% success through biopsy. Pregnancy rates of embryos biopsied for pre-implantation genetic diagnosis is 76.2% pregnancy rate. We achieve high pregnancy rates even in patients whose frozen embryos are thawed and refrozen after biopsy and rethawed at the time of transfer, namely fed PGD, pregnancy rate 68.5%. Şişli KOLAN IVF success is not coincidence. We don't compromise international scientific standards. All materials in contact with culture in our embryology laboratory are embryo-tested materials. Presence of a team of experienced reproductive endocrinologists and embryologists. The use of the host test, which reflects sperm functionality, as well as morphology in sperm selection. All of these increase our success. This is one of my laparoscopic surgery women. Leading IVF centers should also be successful in endoscopic surgery. Physicians working in the KOLAN IVF center make a great contribution to the increase of IVF pregnancy rates with successful hysteroscopic and laparoscopic surgical approaches when necessary. All kinds of endoscopic surgery are performed in our clinic. Hydrosalpinx. Hydrosalpinx, when toxic fluid accumulated in the tube, it is called hydrosalpinx. This is the hysterosalpingography view of hydrosalpinx, and this is the laparoscopic view of hydrosalpinx. Hydrosalpinx reduces clinic pregnancy rate in IVF treatment by 50%. Treatment of hydrosalpinx, laparoscopic salpingectomy or proximal tubal occlusion. Endometriosis. It is a disease in which the cells of the inner layer of the uterus adhere to tissues outside the uterus, usually due to retrograde menstruation. Infertility and pain are the main symptoms of this disease. Endometriosis found in 1 in 10 women of reproductive age. Approximately half of infertile women have endometriosis. Advanced stage endometriosis, stage 3 and stage 4 endometriosis, infertility treatment in advanced stage is IVF treatment. Laparoscopic surgery treatment is rarely performed only if there is a large endometrioma in the anatomic localizations that interferes with pelvic pain or oocyte retrieval. Fibroids or leiomyoma uteri, 20 to 40% of women in reproductive age are affected by leiomyomas. Leiomyomas associated with 5 to 10% of cases of infertility. Because of the delay of childbearing in recent years, fibroids are more common in IVF patients. Myoma uteri treated by laparoscopic myomectomy. Reviews of previous studies indicates a pregnancy rate 50% after laparoscopic myomectomy in infertile patients. Sometimes IVF patients may need hysteroscopic surgery. Conditions such as endometrial polyp, leiomyoma uteri, septum uteri, and Asherman syndrome may prevent pregnancy in IVF patients. In such cases, hysteroscopic surgery increases the success of IVF. Asherman syndrome, if there is an adhesion in the inner layer of the uterus, it is called Asherman syndrome. Treatment of Asherman syndrome with hysteroscopic method increases the success of IVF. Intracavitar leiomyoma uteri or fibroids are resected by hysteroscopy. Endometrial polyp is also resected by hysteroscopy and increase IVF success. Septate uterus is a Müllerian congenital anomaly. Septate uterus can be treated by hysteroscopy. Stem cell and platelet-rich plasma can be used in IVF patients. Stem cells and PRP rejuvenation effect can be used to improve oocyte quality in premenopausal or premature ovarian insufficiency patients. It is also thought that the use of stem cells or PRP may be beneficial in teen endometrium or endometrium with impaired receptivity. In our Turkish Scientific and Technological Research Institution supported animal study published in 2019, in this study, we saw green fluorescent protein positive cells in the follicles of ovaries. These green cells in the follicular state. So green fluorescent protein positive cells shows presence of mesenchymal stem cells activity in the follicle. It was shown that the combined use of vascular endothelial growth factor, positive adipose tissue derived mesenchymal stem cells, and PRP increased ovarian function in this study. Thanks for your attention. Thank you very much.
Professor, if you stay with us for a few seconds, you stop your sharing. Yes, there is a questions come from Uzbekistan actually. They said that they are referring a lot of patients to Turkey. We know their question is their message exactly like this. They are saying that we know that Turkey, according to the Turkish law and regulation, is not possible for egg and sperm donation and surrogated mother. But we know that KOLAN Hospital Group has a hospital in Cyprus, in North Cyprus. According to the Cyprus regulation, can be referred some patient, IVF patient, for surrogated mother and sperm and egg donations. Professor Birol, have you heard my question?
Yes, in Cyprus, not in Turkey.
I mean,
in Cyprus, Cyprus British IVF Center link to our hospital, and they will go there for their.
It's possible that they can take the treatment not in Turkey but in Cyprus,
In Cyprus.
British Center. Yes. Correct?
Yes, correct.
All right. Thank you very much, Professor Birol, for your participation, and we thank you for your sharing your knowledge and experience with us. Thank you.
Thank you very much.